Good morning and welcome. Thanks, Fryni and Ben, for joining us today in our REMO seminar titled Facilitated PhD Support Groups and Effective Mental Wellbeing Intervention. So I'm only going to act as a very basic host today, and I'm going to let you guys introduce yourselves and provide us an overview. And yeah, we'll give you around 30 minutes for the presentation. Can go a little bit longer, and that's fine. And then we'll open it up to our participants for some questions and answers and interaction afterwards. So the questions and answers section won't be recorded for anyone. So if you want to ask pertinent questions or things that you wouldn't normally want to share outside the public domain, don't worry, it's that part of the process isn't recorded. And yeah, without further ado, I'll hand the mic over to Fryni and Ben. So thanks very much for joining us, guys.
Thank you.
Thanks, Scott.
So hi, everyone. My name is Fryni. I'm the PhD Student Support and Wellbeing Lead at the Francis Crick Institute, which is a biomedical research institute in London. And before that, I used to manage the professional and personal development program of doctoral researchers at Queen Mary University of London, which is where Ben is.
Hi, thanks. I'm Benjamin Priest, Ben, and I'm a counsellor at Queen Mary University of London. So I'm going to take you through our plan for the session today. So first of all, we're going to give you some background to the PhD support groups that we've been running over the years. And then we're going to share some results from our groups, including improvements in wellbeing and confidence in completing the PhD. And then we're going to finish the presentation part of the session today by giving you some practical tips for setting up support groups in your organization. So we'll be talking about the role of the facilitators and participants, how the sessions run from week to week, and the difference between co-facilitation, which we did together at Queen Mary, and solo facilitation, which we've now been doing for the last year and a half, with Fryni doing groups at the Crick and me doing groups at Queen Mary as solo facilitators. And then we're going to finish by talking about what support and resource you need to set up the groups.
So to give you a little bit of a background on how these PhD support groups came about, as you know, also through REMO, over the last decade, there's been quite a lot of attention on the prevalence of mental health issues in the PhD population. And in 2018, we received funding from Research England and the Office for Students for 18 months. So that was at Queen Mary. And the funding was specific to running new initiatives that would support the PhD, to support the mental well-being of PhD students. So we introduced a new initiative, the PhD support groups, which is a peer intervention that has some therapeutic elements. So while I was still at Queen Mary, I left about 1.5 years ago, as Ben said. Up until then, we had run 13 groups together. And then since then, we've run 7 groups individually across our 2 separate organizations.
So defining support groups. We've included a definition here of support groups that we like. Support groups meet for the purpose of giving emotional support and information to persons with a common problem. They're often facilitated by professionals and linked to a social agency or a larger formal organizations. And the meetings are relatively unstructured. So the aim of our PhD support groups is to support the group members to support each other with the emotionally difficult issues related to the doctoral experience. So the format of the PhD support groups. 2 very important things to start with. The groups are confidential, so we ask everybody to agree that we keep everything that is said in the group within the group itself, and we don't reveal the membership of the group to anyone. And in my organization, the groups are covered by the same confidentiality rules as individual counseling. So the groups are confidential. That's very important for people to feel safe talking about the personal struggles they might be having with the PhD, and also aspects of their personal life which affect their PhD experience. Strict attendance is another important factor. So basically, for the group to feel safe, we need to make sure that the same people are there every week, because if you're talking to somebody about something personal and they're supporting you, or vice versa, you want to see that that person is going to be there the next week. The groups are facilitated by us, so originally by me and Fryni together, and now separately. And the members in each group, we started out the groups with 12 members in each group, but we found that that was actually quite a lot of people, actually, in terms of covering everybody's issues in an 8-week cycle of a group for 90 minutes each week. That was quite difficult. So the groups currently have a maximum of 9 people in them, and they usually do have 8 or 9 people in them. Everybody who wants to join a group fills out a very short survey online, and then we meet them for a 15 to 20-minute individual appointment. That's really mainly to give people more information about the group so they can see whether they want to join it when they know more. But it's also for us to just check a few things about their mental health and well-being, just to check suitability. So for instance, if somebody was actively suicidal, I would be signposting them to individual counselling, because in a group, active suicidality is hard for the group to manage. It tends to all become about that issue. So there are certain contraindications that we'd be looking out for. The main one would be some sort of mental health condition that would make it difficult for someone to be in a group, or active suicidality. So the groups run for 8 sessions, and during the pandemic, we were running them online. We're going to talk about that more later. And the groups ran for 75 minutes. But when we're doing them in person, they tend to run for 90 minutes. And in the room, the group takes the form of the group members just sitting in a circle in a private room. That's very important, with the facilitator. And it's an unstructured conversation. So we don't try to introduce themes or topics. We don't try to lead the conversation. It's an unstructured conversation every week. So as I mentioned, during the pandemic, we ran some groups online. During the first COVID-19 lockdown, one group started in person and had to move online. And then we ran 6 groups exclusively online. And when we were running these groups online, we were aiming to recreate the experience of people being in that circle in a room together, to create that sort of intimate atmosphere where people could share things personally. So we introduced a number of ground rules to do that. So we insisted that people had their cameras on. And also we wanted to make sure that we maintained the same confidentiality. So we made sure that group members were joining from a private space and that they had headsets on. We asked people not to use the raise hand feature, because we wanted to keep that sense of an unstructured conversation. We wanted the conversation to try and flow as much as possible. And we asked people not to use the chat function. So basically, we were asking people not to type things, to say things as if we were in the room together. And in a nutshell, we saw similar wellbeing improvements as the in-person groups, but the improvements were better in person. And we're going to come on to that data of the outcomes in a minute. Yeah.
So to move on to, we'll move on to talk to the findings from our 13 groups that we ran together. So firstly, to give you a little bit of context in terms of who tends to join these groups, the doctoral researchers who sign up usually are at greater risk of dropping out of their PhD than other students. So here you see that 58% of our participants, of our 109 participants, had said that they consider dropping out of their program, leaving their program, and compare that to the UK PhD population, where only 28% have said have declared that. Before I move on to the next few slides, I'll just highlight that the data, wherever we say UK PhD students, the data comes from PRES, the Postgraduate Research Experience Survey, which is a large national survey in the UK, which runs annually. So we've used that as a benchmark whenever we compare our data to the PhD population. So to measure the effectiveness of our support groups, we ask participants to complete the same survey using the same set of questions, both at the start of the group and then again at the end, so after they've attended a group for 8 weeks. And one of the things we measure is changes in mental well-being, and we use an established well-being scale called the Warwick-Edinburgh Mental Well-being Scale. So the reason we've used that scale is because it's suitable for capturing changes in well-being after short interventions like our support group. So the scores on this scale range from 14 to 70, with greater scores indicating greater well-being. And to give you a benchmark, here you see that the mean score of adults in England in 2016 was measured at 49.9. And a little bit more context, so scores between 41 to 44 are indicative of possible or mild depression, and a score of less than 41 is indicative of probable clinical depression. So now if we look at the scores of the mean scores of our group participants, you see that the starting mean score starts within the risky ranges, right? So the ones that possibly indicate a possible or mild depression. But importantly, by the time the participants finish their 8 sessions, you see that the mean scores go above this danger zone. So it reaches quite close to the mean score of adults in England. And Ben talked about how we ran 6 groups online. So here we've separated the results by mode of delivery. So what you see here in the blue line are the online groups, and in the purple line, the in-person groups. So you see that they're both starting at a pretty similar score, but then the improvement for the online groups is not as dramatic, perhaps. So I think people could argue that perhaps the reduced improvement in the online groups is linked to the pandemic and the uncertainty that was caused because of that. And we think that that could be a factor, but we also think that that's not the only thing at play here. We know from our experience of being in a room with people that when you are together in a room, then that creates a very different experience, and people feel that they're more able to connect and open up in person. And we've definitely felt that as facilitators as well. And another reason why I think it's not really a pandemic effect only is that if it was a pandemic effect, I would expect perhaps the starting mean score to be lower for the online groups, but it's not. It's actually very similar to the in-person groups. And also we did run 6 groups during that time between October 2020 to May 2022. So especially during the second year, things weren't as uncertain anymore because of the pandemic. Things had settled a lot more. So this links back to what Ben was saying about the online groups maybe not being as effective as the in-person groups. So in addition to the Warwick-Edinburgh Mental Wellbeing Scale, we measure our participants' subjective wellbeing on different scales, and that includes the Office for National Statistics wellbeing question. So the ONS, the Office for National Statistics, has 4 questions. The first one is around satisfaction with life. So what we see here is the percentage of participants reporting very good life satisfaction at the start of the group, and then again at the end. So we see improvement around that. So by very good life satisfaction, we mean that these are the participants who selected scores 9 to 10 on a 0 to 10 scale. And again, we give you the sort of benchmarks where the UK PhD students were in 2019, and also UK adults last year. We also see an improvement in the percentage of participants reporting very high worthwhile, so feeling that what they do in life is worthwhile. And in terms of happiness, we see that the percentage that reports high levels of happiness by the end of the group is actually higher than the percentage in the UK PhD population pre-pandemic. So there's a considerable improvement in that statement. What I would like to point out is that you can see that consistently our participants are still considerably lower than the general population, but that's quite expected given what we know from literature on PhD mental well-being compared to the rest of the population, that typically PhD students score lower on well-being measures. We've also found that our support groups reduce high anxiety in participants. So most group participants, so you see here, it's just over 60% of our participants reported high anxiety at the start of the intervention. But then by the end of the intervention, the percentage of participants that report high anxiety drops well below the UK PhD benchmark, again, pre-pandemic. We found that the groups help reduce loneliness. So our participants feel that they have someone they can talk to about their day-to-day problems. So when the group started, less than half of our participants agreed that they did have someone to talk to about their problems. But then by the time the intervention ended, more than 80% of them agreed that they did have someone. Another loneliness question that we ask also shows that fewer participants feel often or always lonely by the end of the intervention. Sorry, did I skip one? No. Okay, so another important finding is that the groups help participants feel more confident in their ability to complete their PhDs within the institutional time frame. And that's important because, as we've seen earlier, most of them have considered dropping out of their PhD. So the group does help them feel not only that they're able to complete their PhD, but also they're able to complete it within the 3 years or 4 years of their funding. And of course, if they have higher confidence, then that's also a sign of good well-being, because it suggests that the participants are able to learn and be productive as well. Sorry, my mouse is not working very well.
So in terms of why we get these outcomes, we also get qualitative feedback from the participants of the groups. And that qualitative feedback, the comments that they make about what has been helpful about the support group experience, closely maps onto these helping characteristics of support groups from the literature. So I'll just take you through those. So universality, I can never say that, universality and an alternative to loneliness. So the big factor in poor PGR mental health is isolation. And so that is why the groups exist, essentially, to bring people together, to share their experience and to find that other people are having a similar experience as well. So that comes out in the qualitative feedback a lot, that people have found that helpful. Communicating experiential knowledge, so learning from own or others' experiences. So sometimes people might share tips, for instance, on how to talk to their supervisor, although that's not the main focus of the groups. The main focus is just emotional support, really, which I'm moving on to here. Support, empathy, listening to others, and personal disclosure in a safe space. The feedback from the group shows that that's a very powerful experience for the participants, and they find that very, very helpful. And the installation of hope. So over the 8 weeks, you often see people make changes in how they conduct and go about their PhD, which help them to feel better and improve their well-being. And that instills hope in the group as a whole. So for instance, somebody might, through the group, find the courage to talk to their supervisor about something that they've been bottling up for a long time and have been intimidated about talking to the supervisor about.
So obviously there's a question about whether the positive effects of the groups stay with participants in the long term. And that's something that we've never really had sufficient time to look into. But this year, while I've been running my support groups at the Crick, I've been able to dedicate a bit more time to think about that. So I've planned a 4-month follow-up session after each group ends, and I've been able to run one of those follow-up sessions already. So this is, again, I'm not giving the data because it's such a small number of participants, but I'm giving some of the qualitative results as well, that basically show that since attending the group, participants do feel that their attitude towards their PhD has changed in a more positive way. And the things that they've mentioned as being helpful and what they've been doing differently were things around applying good habits, feeling less responsible for a situation that perhaps is bad and they cannot really fix. They feel more like they belong at in their organization, that they have increased feelings of belonging, and don't feel like imposters and that they're not part of their cohort, that they're not good enough. Some of them have mentioned seeking additional professional support. They've mentioned that they felt less isolated, which again, you've seen coming through in the quantitative results as well. They found their sense of agency, which I think is quite important. They've been able to be more open and honest about issues with their supervisors, their peers. And also, I think for me, the most important one is detaching their self-worth from their PhD project, which is an issue that's very common in the PhD population. So the Wellbeing scores, because I did measure the Wellbeing scores, do seem to dip a little bit, the quantitative results, if we look at those, but they're actually not quite as bad as the scores at the start of the group. So we'll see, watch this space, because I think there's more data that's going to be coming in the next few years. So we'll move on to practical tips for setting up support groups.
Okay, so I'm going to take you through the practical tips for setting up support groups, and just to add that when we finish the presentation, obviously there'll be time to answer questions, anything that's in the chat, or any questions that anyone has, will come to them then. Okay. So the role of the facilitators, first of all. Point one is conducting the group so that people feel safe to attend and talk, and there are various elements to that. So emphasizing the confidentiality of the group, both when we meet people individually to talk about the group and at the start of the process and all the way through, so that it feels safe. And ensuring that no one member dominates the discussion and the conversation each week. Obviously, some people talk more than others, and so it's our job as facilitators to try and manage that so that it's not one person's problem that we're focusing on all the time. And inviting quieter members of the group to share. So obviously some people find it quite difficult, and when we meet people individually, we do ask questions about what they are like in groups generally. Do they tend to talk a lot? So we can get a kind of idea before we start about how comfortable people might feel. Obviously, in the first few sessions, people are nervous and they need help to start talking. We'll talk about that a bit later. Modeling an empathic response. So asking questions, being curious. How do you feel about the fact that you weren't able to write anything yesterday, for instance? How did you feel about that meeting with your supervisor? Are you okay this week? You seem quite quiet. And also empathizing with people. That sounds really difficult. You know, just modeling the response that we want the group members to show to each other. Addressing boundary issues, e.g. non-attendance or lateness. So, you know, you are responsible for the whole group and the experience of the whole group. So if somebody is breaking the boundaries by not attending for consistently, they may have to leave the group, for instance, and you need to address lateness. So being mindful of cultural aspects of the PhD and support group experience. So of course, different cultural attitudes and norms towards mental health may mean that some people from certain cultures may find it harder to be vulnerable in the group or to share experiences of anxiety and depression. So it's being sensitive to that. So continuing with the role of the facilitators, it's also about making space for personal aspects that come into the PhD experience or are affected by it. So that might be personal or family relationships. So somebody may have had a bereavement, for instance, and that may be affecting their PhD, or they may be in the middle of a relationship breakup, and that may be affecting things as well. So it's encouraging people to bring the personal aspects of their lives to the group. Identifying themes and making connections. So that's sort of like, okay, your experience with your supervisor reminds me of what you were saying last week, X, about the meeting that you had, so making links between themes that are coming up, also pointing out general themes like feeling neglected, perhaps feeling isolated. We also might offer or signpost solutions, practical solutions within the university processes, but we resist urges to make everything better or try to solve things. And that's because A, we can't, and B, importantly, we want to avoid people taking individual responsibility for systemic problems in the PhD experience.
So moving on to the role of the group members, that's quite straightforward. So they're there to listen to each other, be curious and ask each other questions, and also relating to other participants' experiences, or if they had a different experience, to share how their experience differed to the other people. To very quickly take you through how the sessions run. So in the first session, everyone is quite uncomfortable when they come in usually because they don't know each other. So we do a quick introduction of everyone in the circle. We remind them of the ground rules that Ben went through earlier. We remind them of their role, so to listen, ask questions, and so on. And then we bring up some common themes that come up in these groups. So, for example, issues in the supervisory relationship, imposter syndrome, lacking motivation, feeling isolated, worries around career prospects, and so on. So we bring up these common themes, and then we ask them to discuss these themes or what brought them to the group in pairs. And we do that as an icebreaker to kind of ease them into the process. So after they've discussed for 10, 15 minutes, we then all come back in the circle and have a go at having an unstructured open discussion and supporting each other. Then in sessions 2 to 7, we basically just have a free flow conversation in the group, and people are supporting each other. With some groups, we started introducing a check-in at the start of the group where we go around the group and each person will say how they've been over the last week, and maybe mention something that they want to bring up that week in the group that they want to discuss further. And the reason we introduced that was because it can be useful as an icebreaker, especially if it's a quiet group and if the same person tends to always initiate the discussion. And it also helps participants, but also us as facilitators, to identify connections and themes. The negatives of it is that sometimes it can take a long time, so participants might kind of abuse it in a way and just kind of go on and on about their problem. So it then becomes more of a monologue than a discussion. So it doesn't work with every group, but sometimes it's helpful to have that. And then in the final session, again, we have an open discussion, but we also try to address different elements as well. So we allow some space to think about the ending of the group and get the participants to reflect on what they're taking away from the group and also what changes they will make with regards to their experience as a result of the conversations that were happening in the group. And we get them to think a little bit more, to focus more on the psychological and emotional experience rather than, what they can do practically about their PhD and the research skills.
So co-facilitation. So as we mentioned earlier, we did 13 groups together at Queen Mary, University of London, when we started out doing these groups over about 4 years, I think.
Yeah, 4 and a bit.
4 and a bit. And we brought different perspectives and expertise to the co-facilitation. So obviously as a counsellor, my expertise in psychological and emotional support. And Fryni's expertise is in practical support with PhD issues and with a PhD experience, with, particularly relating to well-being. So the advantage of co-facilitation, we got to reflect together after each session. We could share concerns and worries about the group. We could give feedback to each other about our facilitation and also reassure each other about that. And we could do some troubleshooting. So if there were boundary issues, someone's coming late all the time, or if there are difficulties in the group dynamics, two group members really aren't getting on, then we could address those or plan how we're going to address them in the next session. And we could also acknowledge the limits of what we can do as facilitators, which is very important because you feel a great sense of responsibility when you're facilitating a support group. And it's important to remember that you are limited in what you can make happen in a group and in how much you can affect group dynamics. And most importantly, we supported each other, with the emotional experience of facilitating the group, in a parallel process to the group, really.
Yeah, so I think it's fair to say that we've both found it quite tough when we've started having these groups on our own. One of the things to bear in mind is that you have the sole responsibility for running the session and remembering what happened in previous sessions as well. It can bring up sort of feelings of imposterism in you as well, whether, am I doing enough? Am I doing too much? Would Ben or Fryni, would the other person have done something more useful perhaps? And then at the end of the session, you don't have the opportunity to kind of get feedback. So you're left with your own thoughts or worries about how a session went, perhaps. So you're feeling a bit more uncertain about a session. And on a practical level, you also don't have anyone to share the admin workload that the process creates as well.
So parallels with the PhD experience and the support groups. So with solo facilitation, we've found there is a parallel with the PhD experience in terms of feeling isolated. So a sense of isolation, imposter syndrome, getting it all wrong. Fryni would know what to do in this situation, but I don't. Uncertainty. It's just much harder to gauge how the group went because you've got no one else with their eyes on it in a way. And also that sense of carrying out a really important and emotionally demanding project on your own.
And with co-facilitation, obviously there are parallels with the support group experience. So you're able to kind of share between you honestly and show vulnerability if you're uncertain about how a session went. We would often help increase each other's confidence, although we would often also try both kind of despair together. And in general, you kind of share the project experience as well.
But would we have felt the negatives of solo facilitation if we hadn't co-facilitated first?
And we were also wondering whether, if we would have been able to even do it independently on our own, if we hadn't done it together. So I don't think we can answer these questions, and I don't think it should put you off if you're considering introducing a PhD support group. This is just our own experience of doing it together and then doing it on our own.
So it's important, whether you're doing it solo or as co-facilitator, to think about who would support you in your group work. This is absolutely vital because it is emotionally demanding running a PhD support group, and it will bring things up for you. And also sometimes it doesn't go very well. And so you need support in your facilitation. So what we found really helpful is supervision by an experienced group therapist. So we've both been having supervision by an experienced group therapist, and that's helped us to process our facilitation and our experience of the groups. And I would say that's not a supplementary requirement, it's an absolutely necessary requirement. So you really do need to have dedicated supervision if you're going to run one of these groups.
And then final consideration is to think about what resource you have. So obviously you'll need to think about the time that you have to dedicate, it's not just about running the group. You have to remember that you have to account for the individual appointments that you have with potential participants to see whether they're a good fit for your group. But also think about the admin time, so promoting the group, recruiting, setting up your individual meetings, analyzing any data, and so on. And the very last thing to say is some recommendations. So make sure that you identify an appropriate space. If you're going to be introducing these groups, you want to make sure that no one's visible and they cannot be overheard. Avoid a room in a busy hallway, because then people will feel bad if they're seeing going in and out of the room. Make use of supervision. As Ben said, it's important to have support for yourself. And we also strongly recommend that you make evaluation a core part of your initiatives design, because then you can make a case that you have something that really works and you're able to introduce it. And I always say that if I didn't have all the data that we had, all the results that we had from Queen Mary, I wouldn't have been able to just go at my new organization and kind of say, I want to run these groups, and it takes, quite considerable resource if I wasn't able to justify, look, this really works. So do consider that. Yeah, and we highly recommend that you try it out. So we'll leave this up while we're taking some questions. So these are some of the comments of our participants about what they've been finding useful for the from the PhD support groups.
Cheers, thanks, Fryni and Ben. This has been a fantastic presentation, and I've been sort of sitting here mentally taking a number of notes as to some questions and ideas, and it's been great to sort of see how this initiative has played out. And again, thank you very much for presenting that. I know this is going to sound crazy, but maybe there was a few people who joined after the introduction. So we've got a question in chat, and maybe this is sort of a nice way to conclude things before I actually stop the recording. So it's the only question that I'll include in the recording, but maybe you guys can just give a brief overview again of yourselves, an introduction or an outroduction, I guess we'd call it. Maybe you can just provide a quick summary on how often the sessions were and how many people there were in each group.
So in introduction of myself, so I'm Fryni, and I'm the PhD student support and wellbeing lead at the Francis Crick Institute, but previously I worked with Ben at Queen Mary University of London, where I was supporting the researcher development in doctoral researchers.
And I'm Ben Priest. I'm a counsellor at Queen Mary University of London in the Student Counselling Service.
The question was about the sessions. I think the format. So we ran. So each group ran for 8 sessions. So there were weekly sessions of 90 minutes each, and we did start with 12 participants initially. That was way too much, and for us, I think now the magic number, we're both doing 9 participants, because even if one person kind of changes their mind, 8 is a good number, 6 is a good number even. But yeah.
6 is actually quite nice, but obviously you want to try and get as many people as possible.
And
it's 8 sessions, so 8 consecutive weeks that the group meets for. So at Queen Mary, I will run 3 of those groups in a year.
Awesome. All right. No, that's great. That just provides also a nice quick snapshot summary at the end of the session for people who are interested in the format. What I'll do is I'll just stop the recording now, and then we'll dive into some of the questions that are starting to flow in through the chat. So again, thank you very much, Fryni and Ben, for the presentation. It was really great. And looking forward to a really good Q&A now. So thanks very much.